In this short video, I'm going to go over how to introduce yourself to patients in Spanish. And this will be flexible enough that you could use it with various professions. It's kind of like the default as if you're the doctor, but there's a lot of other people that could use basically the same dialogue as well. All right, so I'm going to say each phrase or word in English first, and then I'll say it in Spanish a couple times. And ideally, you want to repeat it out loud each time and kind of practice, because the hardest part about learning Spanish is saying things out loud, actually talking. So get as much practice with that as you can, especially when you're listening to a video like this. All right, so here's the first word, super easy. How do you say hello in Spanish? Hola. Hola. Next one is a pleasure, meaning like a pleasure to meet you, but it's just kind of like much pleasure. Mucho gusto. Mucho gusto. And of course, you would use these together, not just one at a time. You kind of make a whole sentence and say, hola, mucho gusto. But I'm doing them separate, just so you can more easily practice each part. All right, so the next part is something I usually do in the emergency room because it makes a lot of sense there, and that is I confirm their name. Is your name such and such? So how would you say, is your name Carmen? ¿Usted se llama Carmen? ¿Usted se llama Carmen? So that may or may not make sense to use in your setting, but for me it does because, I don't want to accidentally start talking to the wrong patient, and I've never met these people before. So it's just kind of a way to show that I know their name, but also to make sure I'm talking to the right person. All right, so the next one is you're going to tell them your name. And how would you say, my name's George? Yo me llamo Jorge. Yo me llamo Jorge. Or just me llamo Jorge. So, of course, replace Carmen or Jorge with whatever the appropriate name is, their name and your name. You may or may not want to use these exact phrases, but if you do, that's how you can confirm their name and then tell them your name. All right, so next you're going to tell them your role or your profession, why you're there. So we'll use doctor, but you can replace it with whatever you need to. So how would you say, I'm the doctor? Yo soy el doctor. Yo soy el doctor. So if you're a lady doctor, you'd say la doctora. If you're something besides a doctor, I have that in brackets there to say get rid of it, replace it. So just know the name of your profession. If you're a nurse, you could say soy el enfermero or la enfermera. If you're a PA like me, you might say soy el asociado médico. There's not really a good translation for PA, but that's just one example. Or if you're something else, just know the name of your profession and then stick that in, soy whatever. All right. So the next one is kind of confirming why they're here, and it's a good segue into whatever you're going to talk about next, like clarifying their symptoms and stuff like that. So it's, did you come here because ... Did you come here because? It could be because your foot hurts, right? But whatever it is, did you come here because? Vino aquí porque. Vino aquí porque. And then whatever follows. Le duele el pie, your foot hurts. Or le duele el pecho, your chest hurts. Le duele el abdomen, your abdomen hurts. Or any other body part, or a different reason that has nothing to do with pain, whatever it is. And this is a good segue, like I said, because you can then start talking about, well, how long has it been hurting? What makes it worse? And all the other questions that you might want to ask. If you want to see some more medical Spanish dialogues, I've got a playlist here with a bunch of those. And if you want to work on your basic Spanish, I've got some really high yield videos that show kind of how to pronounce things and really common vocab and other stuff like that. So check it out. Thanks for watching. I'll see you next time on Learn Medical Spanish.